Okay, so we will start with penicillin then. Okay, मैं एक साइड से एक तरफ से सारे मेडिसिन एक एक करके one by one I will complete them. But for this time I will explain all the thing in a summarized form. Okay, so we will start with penicillin. The penicillins were the first antibiotics to be isolated and used clinically in 1941. It was isolated from fungus Penicillium notatum. So penicillin was the very first antibiotic and it was discovered in 1941. Or no, it was not discovered. It was used on a clinical field in 1941. The first use was on 1941 and it is derived from this penicillin injection is derived from the fungus called Penicillium notatum. Okay. All penicillin contains a beta-lactam ring in their structure, which is responsible for their antibacterial activity. Okay, so this penicillin has in their chemical structure, they have a beta-lactam ring, and this beta-lactam ring is the key structure which is responsible for antibacterial activity, okay, for their antibacterial properties. So like you can see the examples of cephalosporin also contains beta-lactam ring. So along with penicillin, there is another category of medicine that is cephalosporin, which is also an antibiotic medicine. Cephalosporin also have beta-lactam ring. Okay, so penicillin and cephalosporin both has beta-lactam ring in their basic structure. When you will see their chemical structure, you will find beta-lactam ring. So now we will move towards the mechanism of action. Penicillin inhibits the synthesis of bacterial cell wall. If bacteria divide in the presence of penicillin, cell wall cannot be synthesized. Bacterial cell wall cells swell and burst. Bacterial cell lysis, and thus the penicillin are bactericidal in nature. So what this penicillin does is they inhibit the synthesis of bacterial cell wall. Okay, so they stop the synthesis of bacterial cell wall, and if a person is taking, if a patient is taking penicillin penicillin in the form of medicine, so what will happen? The cell wall of bacteria will destroy, or the bacteria will not be able to synthesize their cell wall, and in this way, if the bacteria is not able to form their cell wall, then what happens? The cell of the bacteria will burst out. First of all, they will swell out, and then after that, because of not presence of any boundaries, they will burst. And likewise, this kills the bacteria. So penicillin acts as a bactericidal in nature. Okay, so they are bactericidal. So now we will see the classification of penicillin. So in classification, we can see first, second, and third classification. The first one is penicillin with no resistance to penicillinase enzyme. So the first classification is based on no resistance to penicillinase enzyme. In this, the medicine will not would not have any resistance against penicillinase enzyme. Okay, so in this there are two subcategories. First one is acid labile. Example of acid labile penicillin is penicillin G. Okay, and next one is acid resistant. So the example is penicillin D1, penicillin, and phenoxymethyl penicillin. So these are the example of acid resistance. Okay, next classification is penicillin resistance to penicillinase enzyme. The first classification was based on no resistance to penicillinase enzyme, and now the second is based on the resistance to penicillinase enzyme. Okay, so under this, further there is the classification which is similar to the first one classification, that is acid labile and acid resistant. In acid labile, you will see the example of methicillin, and in acid resistance, we can see the example as cloxacillin, oxacillin, okay, dicyclosilin. These are the example of acid resistance. Now, the third classification is extended spectrum penicillin. Okay, in extended spectrum penicillin, we see there are 4 subcategories or subdivision. The very first one is aminopenicillinase. Okay, and this one is broad spectrum penicillin. So the example are ampicillin, amoxicillin, vancomycin. So these are the example of broad spectrum penicillin. Second is indeni penicillin. Third is imidinopenicillin, and fourth one is penicillin. So these are the third classification. These classifications come in the third one, that is the extended spectrum penicillin. Now we will see the very first penicillin, which is benzyl penicillin. Benzyl penicillin or penicillin G. This benzyl penicillin is also termed as penicillin G. So this medicine comes in the category in the classification of in the very first classification, which is low resistance to penicillinase enzyme. Okay, this one is a acid labile penicillin. This acid labile penicillin means this get destroyed by when it come in contact with acid, they get destroyed. So if we are taking this medicine orally, then as soon as it reaches our gastric, it comes in contact with a gastric secretion, it get destroyed. So that's why this benzyl penicillin or penicillin Z is given intramuscularly. The route of administration is intramuscular. And this after injection, it rapidly enters the blood, okay, and is spread in extracellular fluid. It is rapidly excreted through the kidney, mainly by tubular secretion. Okay, so it is excreted through kidney. So it has short lifetime. तो इसका लाइफ टाइम कितना होता है? लाइफ टाइम बॉडी में रेजिस्ट रहने का कितना टाइम रहता है? 30 मिनट. ठीक है, उसके बाद ये रिमूव आउट हो जाता है. तो एंटीबैक्टीरियल स्पेक्ट्रम एंड यूजेस, इसका बेंजाइल पेनिसिलिन का जो एंटीबैक्टीरियल स्पेक्ट्रम क्या है और उसके यूजेस क्या है? तो इट इज नैरो स्पेक्ट्रम एंटीबायोटिक. ये एक नैरो स्पेक्ट्रम एंटीबायोटिक है. It primarily acts against gram-positive and some other organism. It can be used in following infection. Other than it is mostly used in gram-positive infection, and other infection in which it is used are streptococcal, pneumococcal, meningococcal, gonococcal, Treponema pallidum, actinomyces, streptococcal infection. This is used. Okay, penicillin. Next is phenoxymethyl penicillin. Phenoxymethyl penicillin. So now in this we will see what are the medicines included in this are the very first one is phenoxymethyl penicillin. Second is methicillin, fluoxacillin, ampicillin. Then is amoxicillin, becamicillin, Carbonicillin, azlocillin, and meslocillin, meselinium. So these are the classification of penicillin, or these are the examples for the classification of penicillin. So now we will see the adverse reaction of penicillin. What are the adverse reaction of penicillin? So the very first adverse reaction is, as compared to their wide use, penicillin are one of the least toxic antibiotics. So although this, you can see this penicillin is used in a number of disease condition, है ना, बहुत सारे disease condition में penicillin का use होता है, और ये broad spectrum antibiotic है. Still इसका जो टॉक्सिसिटी है ये बहुत कम है. दिस इज द लीस्ट टॉक्सिक एंटीबायोटिक. ठीक है, तो ये तो हो गया पॉजिटिव प्लस पॉइंट हो गया ये पेनिसिलिन का. नाउ द एडवर्स रिएक्शंस आर, फर्स्ट इज पेन एंड एब्सेस फॉर्मेशन में अकर एट द साइट ऑफ इन्फेक्शन. ओके, द पेशेंट में फील पेन and there might be abscess formation at the site of infection. So this is it. And second is hypersensitivity reaction may manifest in the form of rashes. After injection, the person may complain of hypersensitivity and in the form of rashes, or either itching, fever, serum sickness, or anaphylactic penicillin growth, anaphylactic shock. Okay, so these are the adverse reaction of penicillin. One can also encounter drug-induced diarrhea. So these are certain adverse reaction of penicillin. So now we will move towards the cephalosporin, which is a broad spectrum antibiotic. Okay, it is a broad spectrum antibiotic. So in case of this penicillin, generation 1, first generation, is narrow spectrum, and this generation 2 and generation 3 penicillin is broad spectrum. Okay, now the cephalosporin is broad spectrum antibiotic. Cephalosporin is also a group of similar antibiotics which are chemically related to penicillin. This group also contain beta-lactam ring in their chemical structure. They are usually semi-synthetic products, and their original drug is obtained from a fungus Cephalosporium. Okay, according to their sequence of development and antibacterial spectrum, they are divided into, again they are also classified as first generation, second generation, and third generation. Now we will see the antibacterial spectrum. The first generation का antibacterial spectrum क्या है वो देखेंगे हम. ओके, तो इसमें हम ये देखेंगे कि the first generation cephalosporins are more active against gram-positive organism and less active against gram-negative organism. So this first generation cephalosporin are more active towards gram-positive and less active towards gram-negative, and they are active against streptococci, streptococci, Escherichia coli. Okay, Proteus, H. influenza. Okay, this was the antibacterial spectrum for first generation. Now we will move towards the antibacterial spectrum of second and third generation of cephalosporin. Second and third generation cephalosporins are active against gram negative organism and less active against gram positive organism. So in this, it's their action is reversed compared to the first generation. फर्स्ट जनरेशन में क्या हो रहा था कि जो फर्स्ट जनरेशन सेफेलोस्पोरिन थे वो ग्राम पॉजिटिव के अगेंस्ट अच्छा उनका इफेक्ट था और ग्राम नेगेटिव की तरफ उनका लेस एक्टिव थे। नाउ जो सेकेंड जनरेशन और थर्ड जनरेशन है उसमें ग्राम नेगेटिव की तरफ ज्यादा एक्टिव है और ग्राम पॉजिटिव की तरफ तो कम एक्टिव है एंड रिवर्स हो गया। ठीक है, इनका एक्शन रिवर्स है। तो ये किसके जनरेशन सेकंड एंड जनरेशन थर्ड आर एक्टिव अगेंस्ट एच इन्फ्लुएंजा, एसर्शिया कोलाई, नेक्स्ट इज प्रोटियोस, स्टेफाइलोकोकाई, स्ट्रेप्टोकोकाई, pseudomonas. These are the bacteria against which generation second and generation third is active. Okay, so now we will see about the mechanism of action of all these medicines. Okay, cephalosporin. Just give me 5 minutes. I will tell you all. Okay, just 1 minute. Now, okay. तो अभी हम लोग देखेंगे कि मैकेनिज्म ऑफ एक्शन। The mechanism of action is similar to that of penicillin. पेनिसिलिन के जैसा ही इनका मैकेनिज्म ऑफ एक्शन है। बेसिकली ये भी क्या करते हैं कि सेल वॉल के सिंथेसिस को डिस्ट्रक्ट कर देते हैं, जिसकी वजह से जो माइक्रो ऑर्गेनिज्म है, तो बैक्टीरिया उसका सेल क्या हो जाएगा, फर्स्ट में स्वेल होगा उसके बाद बर्स्ट आउट हो जाएगा। ठीक है, देयर मैकेनिज्म ऑफ एक्शन इज सिमिलर टू दैट ऑफ पेनिसिलिन. These also inhibit synthesis of cell wall in susceptible organism. If bacteria divide in the presence of cephalosporin, cell wall cannot be synthesized. Bacterial cell wall cells swell and burst. सेम है वैसे ही स्वेल करे करता है और बर्स्ट हो जाएगा। ओके, नाउ we will see about the uses of cephalosporin. क्या यूज है cephalosporin का वो हम देखेंगे। The first use is gram-negative infection includes septicemia, respiratory tract infection, urinary tract infection, hepatobiliary and abdominal infection. तो ये सब कॉज कर सकता है cephalosporin. ओके, के साथ ही साथ और क्या कर सकता है, नेक्स्ट पॉइंट इज mixed infection and hospital acquired infection. Third generation cephalosporins are preferred. तो जो मिक्स्ड इन्फेक्शन और हॉस्पिटल एक्वायर्ड इन्फेक्शन है उसके लिए किसका यूज होता है, फर्स्ट जनरेशन का। ठीक है, नाउ अब हम लोग देखेंगे इसके एडवर्स रिएक्शन, cephalosporin के एडवर्स रिएक्शन को। तो अगर आप एडवर्स रिएक्शन देखें, सबसे पहला एडवर्स रिएक्शन है समटाइम पेन एंड एक्सेस फॉर्मेशन आफ्टर एन आयन इंजेक्शन। आफ्टर एन आयन इंजेक्शन तो कुछ टाइम में हमको क्या देखने को मिलता है, क्या देखने को मिलता है, एक्सेस फॉर्मेशन और पेन होता है साइड में। ठीक है, नेक्स्ट कम्स दी ड्रग इंड्यूस डायरिया, डायरिया भी हो सकता है, ड्रग इंड्यूस डायरिया के अलावा और क्या हो सकता है? हाइपर सेंसिटिविटी रिएक्शन हो सकता है जो कि पेनिसिलिन में होता है। जैसे क्या हो रहा था पेनिसिलिन में, बताओ मुझे। क्या होता है पेनिसिलिन में, बताओ। एनीवेज, स्पेशल इंडिविजुअल ड्रग टॉक्सिसिटी हो सकती है, ठीक है। और हाइपर सेंसिटिविटी रिएक्शन में क्या हो रहा था? पेन हो रहा था, रैशेस हो रहे थे, एक्सेस फॉर्मेशन हो रहा था एट द साइट ऑफ आयन इंजेक्शन, जहाँ पे इंजेक्शन लगा है साइट पे ये सारी चीजें हो रही थी। So here are some nursing point in one nursing point, that is during treatment of cephalosporin, urine may give a false positive test of for glucose with mini test and Sterling and Benedict solution. तो ये फॉल्स टेस्ट हो सकता है, फॉल्स आ सकता है। अगर आप कोई cephalosporin ले रहा है तो उसका शुगर लेवल इंक्रीज आ सकता है। ये जो इंक्रीज आ रहा है वो ड्यू टू हो रहा है किसकी वजह से? ड्यू टू द कंजम्पशन ऑफ दिस मेडिसिन cephalosporin। ओके। आई होप कि आप लोगों को समझ में आ रहा है। आर यू ऑल गेटिंग मी? आर यू अंडरस्टैंडिंग व्हाट आई एम टेलिंग यू ऑल? क्योंकि मैं बता रही हूँ आप लोगों को समझ में आ रहा है, प्लीज आंसर स्टूडेंट्स, प्लीज आंसर करें।
यस मैम।
ठीक है, तो अभी देखो आज पेनिसिलिन और ये सिफेलोस्पोरिन हो गया है। अगर इसमें कहीं कोई डाउट है तो एक बार देख लो विद इन 5 मिनट्स। अगर कहीं कोई डाउट होगा तो मुझसे पूछ लेना। तब तक मैं 5 मिनट का टाइम दे रही हूँ, उसके बाद मैं अटेंडेंस दूंगी आप लोगों को। अच्छा बताओ, कोई डाउट है? हो गया रिवीजन? कोई डाउट है?
नो मैम।
डाउट नहीं है? ठीक है तो। Okay, students, that's it for today's class.